Every second counts when someone is having a heart attack or in cardiac arrest. As we continue to highlight American Heart Month, health experts say this is a time to learn how to perform CPR and how to use an AED to help save lives. Kim Bass is the president and CEO of CPR for Your Heart. She is also an American Heart Association certified instructor. So good morning.
Good morning.
And thanks for sticking with us.
You're welcome.
So earlier you showed us the importance of CPR and how to do it. So now we want to talk about AED. So what exactly is an AED and what is it used for?
Okay, so an AED is an automated external defibrillator. It is used to shock the heart back into a normal rhythm or a rhythm that will sustain life. So CPR is very important, the compression part, but getting the AED on is just as important because that is the one thing that is going to shock your victim back into a normal rhythm and help give him a much better chance of survival. So we have a AED here, and I'm going to show you how it works.
Awesome.
Ready?
So when should you use one and when should you not use one?
Well, if your victim is unresponsive and an AED shows up to your emergency, you should go ahead and put it on then. Your AED will analyze and tell you when to shock. If Fred happens to have a rhythm of some sort, it will not shock. So it's looking for that rhythm as it's going through and analyzing. And the two most important things about the AED, one is to turn it on. The second thing is to follow the prompts, exactly as it tells you to do. They've made it almost, you can't mess it up. You just turn it on and follow the prompts.
Awesome. So you brought one here to our studio. Walk us through how it's used.
Okay. So if you're the one that's bringing the AED up to the emergency, there's probably someone else still doing CPR and compressions. They're not going to stop while you put this AED on. So the first thing to do is to turn it on, and it'll have an on-off button, which will be very evident as to where it's at. So I'm going to turn this on, and it also says lift to open.
Unit okay. Stay calm.
Stay calm.
Responsiveness. Call for help. Attach defib pads to patient's bare chest.
These are in a sealed package, so you'll take them out, pull the sticky things off to make them sticky. She has pictures that show where it goes.
To patient's bare chest.
It's not going to do anything until you get that done. Once they're on there good and sticking good, then it's going to say,
don't touch patient.
And you're going to say clear. You want everybody to stand back because we want to shock Fred. We don't want to shock anybody else.
Don't touch patient. Analyzing.
Continue to say clear.
Shock advised. Don't
say clear
touch
really
patient.
loud.
Press flashing shock
There'll be a
button.
flashing light. I press the button.
Shock delivered. Start CPR.
You will go right back to CPR and it gives you a beat to go to. Some of them will say something like,
push harder.
You need to go harder. Or if you're doing really great compressions,
good compression.
It's going to say that.
Okay.
So you can't mess it up. You continue following this beep until it comes back on and says analyzing victim.
Awesome. So very, very simple. Well, we have to head to break, so we're going to make sure we have all the information about how to use an AED on our website. Thanks so much, Kim.
You're
for
so
being
welcome.
Here with
Thank
us.
you for having me.
We'll be right back.